Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's dive right in. Today, we're going to put on our detective hats and solve a real-life medical mystery. We've got a patient, a bunch of symptoms that just don't seem to connect, and our job? Well, it's to find that one hidden thing, that single culprit that ties it all together.
So, picture this. A patient walks in with hearing loss, some numbness in their face, and a smile that's, well, a little lopsided. Now, at first glance, those things sound completely separate, right? One's for the ears, one's for the skin, one's for the muscles. But you know, in medicine, a weird cluster of symptoms like this is actually a huge clue. It's basically screaming that there's a single underlying cause, and we've just got to find it.
Okay, let's meet our patient. She's a 33-year-old woman, and for months, she's been dealing with this series of symptoms that are just slowly getting worse. Now, the doctors did the obvious thing first. They checked her ears, but they found nothing wrong. No infection, no blockage, nada. So the easy answers are officially off the table. And this is where the real mystery begins.
Let's lay out the clues detective style. First, we have hearing loss that's getting worse, plus a constant ringing, that's called tinnitus, all in her left ear. Okay, seems like an ear thing. But then, you've got numbness on the same side of her face, and that lopsided smile, which tells us there's some muscle weakness going on. And the final clue? A slow blink reflex in her left eye. You put all that together, and it stops pointing at the ear and starts pointing directly at the nervous system. This isn't just an ear problem, this is a full-blown neurological case.
So, if we're dealing with a neurological problem, the nerves themselves become our evidence. Think about it. The brain uses these 12 pairs of cranial nerves to send messages all around your head and neck. So if we can just figure out which of these nerve lines are down, we can start to trace the problem right back to the source. The first clue is pretty straightforward. The hearing loss and the ringing, that points directly to cranial nerve 8, the vestibulocochlear nerve. It's literally the dedicated line for all things sound and balance. So damage here? Yeah, that explains her hearing issues perfectly. Okay, that's one nerve down.
Now, what about that uneven smile? Well, all the muscles you use to make facial expressions are controlled by cranial nerve 7, also known as the facial nerve. If that nerve gets weak, one side of the face can start to droop, which totally explains her smile. And just like that, we've identified our second nerve. And the facial numbness and that weak blink reflex, that leads us to our third and final nerve, cranial nerve 5, the trigeminal nerve. This one's a big deal. It's responsible for all the sensation in your face, including sensing something touching your eye, which is what triggers a blink. And with that, all of our patient's symptoms are accounted for. 3 symptoms, 3 nerves.
So here's the aha moment. We've got 3 different cranial nerves, 5, 7, and 8, all malfunctioning on the exact same side of the head. I mean, come on, that is not a coincidence. No way. This is the key that unlocks the entire case. It tells us we shouldn't be looking for 3 separate problems. We need to be hunting for one problem in one specific location where these 3 nerves are all traveling right next to each other.
Okay, we've gathered all our clues. We've identified the pattern. Now it's time for the big reveal. Let's unmask our prime suspect, the single thing responsible for this entire mess of symptoms.
The diagnosis is a vestibular schwannoma. It's sometimes called an acoustic neuroma. I know, it's a bit of a mouthful, but it is the absolute classic culprit in cases just like this.
And an MRI scan confirms it. Take a look. This is a peek inside our patient's head. You see that bright white mass over on the left? That is the vestibular schwannoma. For months, it was just hiding in there, growing slowly and silently, causing all this trouble.
So what is this thing exactly? Well, first off, the good news is that it's a benign tumor, which means it's not cancerous. It actually grows from something called Schwann cells. These are the cells that wrap around and protect nerve fibers, and it specifically starts on cranial nerve 8, the hearing nerve. Its most defining feature, though, is that it grows really, really slowly, and that's why the symptoms appeared so gradually over months. As it gets bigger, it starts to, well, crowd its neighbors.
All right, so now we know what the culprit is, but to really solve this case, we need to understand where it is, because in neurology, location is absolutely everything. And the location of this tumor is precisely why it was able to cause so much trouble.
So, welcome to the anatomical crime scene, a place called the Cerebellopontine angle, or CPA for short. The best way to think of it is like a tiny but super important intersection inside your head where several major nerve highways all converge.
It's the small little space tucked between the cerebellum and the brainstem, and it just so happens to be the exact spot where our 3 affected nerves, 5, 7, and 8, run right alongside each other.
And now the entire timeline of her symptoms makes perfect sense. The tumor starts growing on cranial nerve 8, the hearing nerve. That's why hearing loss was the very first symptom. Then, as it slowly gets bigger in that super crowded space, it starts to push on its neighbors. It presses on cranial nerve 7, causing the facial weakness, and it bumps up against cranial nerve 5, causing the numbness. It's a perfect cascade of events, all explained by one growing mass in one tiny critical location.
Looking at that MRI again, it all just clicks, doesn't it? You can see the tumor nestled perfectly in that cerebellopontine angle. It's literally physically pushing on the brainstem and the cerebellum. This one image connects all the clues. It shows us the visible physical cause behind every single one of the patient's symptoms. Case closed?
You know, it's pretty incredible when you stop and think about it. On the left, you've got a 19th century anatomical drawing. That was our best guess back then of what the brain's wiring looked like. And on the right, a modern MRI, giving us this crystal clear, totally non-invasive look inside. Technology like this has just completely changed the game for solving these medical mysteries, turning what used to be guesswork into a really precise science.
So after all of that, what's the big takeaway? I mean, for anyone studying medicine, this is a classic must-know case. But for the rest of us, it's just a fantastic example of pure logical deduction in action.
In this table here, this is the whole case wrapped up in a nutshell. It's your diagnostic cheat sheet. You see hearing loss on one side? Boom, you think cranial nerve 8. Facial weakness? That's cranial nerve 7. Facial numbness? That's cranial nerve 5. But when you see all 3 of them together, ding, 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 your brain should immediately jump to one diagnosis: vestibular schwannoma, in one specific location, the cerebellopontine angle. If you remember one thing from this whole investigation, make it this.
You know, this case is just such a powerful reminder that our bodies are constantly talking to us. Symptoms aren't random. They're clues. They're the language of our nervous system. And it just makes you wonder, right? If we can unravel a mystery this complex, what other secrets is our body waiting to tell us, if only we learn how to listen really, really closely?